this is always a good conversation. Depending on the district, LAUSD used to allow 2 eligibilities. They don't do that anymore. They have a primary eligibility, and then if you notice at the top, there's a box that says, there's more words than this, but discuss suspected eligibility. So let's say you have a child with autism, but there's a possibility that they may be diagnosed with ADHD as well, or clinical anxiety, or bipolar disorder. I'm just making something. Even though the primary eligibility, the team might decide that it's still autism, that's where that discussion's going to go. It's going to say, team did discuss possible bipolar disorder, parents are speaking with a psychiatrist. It might say something like that. That doesn't mean the eligibility has changed. It just means it's indicating that the team has discussed it. Okay. And then low incidence is for children that fall under visual impairment, deaf-blind, deaf, hard of hearing, and orthopedic impairment. So unless your children, and that's where you get more of the assistive technology and things like that. So if you wonder why that's not checked on your IEP, if your children don't fall under this category, it wouldn't be. Okay, so this section here, there's a section on both IEPs that basically it says that the child is eligible, or their child meets the criteria to be eligible for special education if their disability is not primarily due to social maladjustment, lack of instruction in math, temporary physical disability, limited English proficiency, lack of instruction in reading, environmental, cultural, and or economic factors. So if those are any of the reasons that your child is not accessing their curriculum, they're not going to be eligible for special education if that is the only reason. Now, you look at our kids, most of our kids, I think most of your kids have autism, that's really hard to tell. Especially like if you have a child that English is a second language and parents are speaking Spanish at home. I mean, how are you really going to tell if the child has a disability versus there's a language issue there, or is it both? So that's what that's for. Really the question that determines whether a child's eligible for special education is, does the disability impact the child's ability to access their educational program? So you could conceivably have a child with cerebral palsy that is accessing their curriculum and they might not be eligible for special education. It doesn't happen too often because usually kids who have a diagnosis of something, it's affecting them in some other way, but that can happen. Not sure it affects anybody here, but it can. Okay, so present levels of performance. Okay, so present levels are, there's a little bug here, are exactly what they say. They're how your child is doing right at this moment in time, okay? You don't want someone cutting and pasting from last year's IEP. Okay? You want to make sure that it really is a present level of how the child is doing. With LAUSD, and I actually required my teachers to do it for all the other districts as well, just because it's easier to do it all the same. You're identifying strengths, areas of need, some districts will say challenges or weaknesses, and the impact of disability. Now, so the strengths it shouldn't just be 1 or 2 sentences. It should really tell you what the child's strengths are. And the areas of need should really tell you what the areas of need are. Here's why. Because what you put in the areas of need, that's going to drive your next year's goals. So if you put one sentence, Johnny really struggles with controlling his temper, that doesn't drive a math goal, that doesn't drive a functional life skills goal, it doesn't really drive anything. Now for the non-LAUSD IEPs, they don't have strength, weaknesses, and all of that, but what they have is a baseline. They have an area called baseline. So that baseline needs to match with the goals that are written. So you can't have a baseline where so-and-so is struggling with double-digit adding and subtracting and simple multiplication, and then the math is measurement. The math goal is measurement. That makes no sense. If you want the math goal to be measurement, and that's an area of need, you need to make sure it's back in that baseline. Okay, so it needs to match. Okay? And the impact of disability, non-LAUSD IEPs don't have this, but LAUSD does. It's going to say the same really for every single present level, because basically it's kind of this blanket phrase that says so-and-so's disability of autism impacts his ability to access, the general education reading curriculum or the writing curriculum. It's going to say the same thing. This is something that's required by the district. Any questions so far? Are you guys completely bored? Okay. Let me know if you are. Okay. So goals and objectives. This is the fun part. Okay, so there are different content areas for kids that are on diploma track, kids that are working on transition, or in transition programs, or kids that are working on functional skills, okay? For us here at Westmoreland, our functional skills, so we get IEPs from all over the place when our kids come in. Once we have that new IEP here at Westmoreland, we change everything to do what we do here. So for our kids on functional skills programs, you're going to have functional reading, functional writing, functional math, self-help, social-emotional, behavior, vocation, and transition if they're that age. So every student who is on a functional skills program here will have 8 goals, maybe more if you have 2 in math or something like that, but a minimum of 8 goals for every single IEP, because those are the areas that we work on. For diploma track, that's a little bit different because it's going to be areas of need. For that child who's trying to get credits, for the high schooler who's trying to graduate, for middle. We don't have any elementary school children that are on grade level right now, but we do have middle school and high school. So that might say there might be a reading goal, there might be a math goal, and then there might be a transition goal and a behavior goal. There might not be 8 because it depends on the area of need. Okay, all of the goals are connected to state standards. So for us, we obviously use the California state standards, the Common Core standards. For our kids on functional skills programs, we actually use 2 programs. One is the SECO, which was created by the County Office of Education for Department of Education for California. And when LAUSD talks about the functional skills curriculum, that's what they're talking about. We have that in every classroom here. I personally don't think it's incredibly user-friendly. So we also purchased the Basics 2, which is the same content area, but it actually was written by the County Office of San Bernardino. And it's a little bit more user-friendly. So we have both in every classroom. Okay, for transition, it's really interesting because I created templates for the report cards that matched every single district and every single course title. So for LAUSD, they might not say functional reading, but LAUSD's functional reading for classroom might be practical reading. And so the titles have to match. And the reason the titles have to match is because when we do transcripts, and then at the end of the day, when you guys go get your certificate of completion or high school diploma, and the school district is looking to see how many credits, and if it matches, they're going to struggle if the names don't match. Okay, so that's why we do that. But it was very interesting because when I called the districts and said, can you send me over your course and your scope and sequence of courses for your transition program, none of them had it. None of them, I mean, I think LAUSD had some names, but none of them had course titles for transition. So what I did was, I mean, some of them did have it, and then we had one. And so what I did was I took every one that I could find, and I created our own. So we have a scope and sequence for transition here. And some of it's pulled from the other districts, but most of the districts, I mean, some of the districts didn't even have course titles for functional skills programs. I would say about half of the ones that we contract with. Which in a way is okay because then I can create it and it matches to our schedule and all of that. So that's kind of nice. Any questions about this so far?
So by course titles, do you mean the curriculum?
Well, no, not curriculum. So functional reading, functional writing, functional math. Like LAUSDs, they're going to call it practical math, community math. So the course titles are a little bit different. But when I would call the districts and say, can you send me your course titles for functional skills program, for your diploma track? Well, diploma track they had. But for functional skills, a lot of them didn't have it. And so we just created it here. I mean, we know the areas. I mean, you can look at the SECO, you can look in the Basics too, and it has all the areas for functional skills. Okay, so this is how Westmoreland writes goals. Okay, I can't speak for anybody else, and there are different ways to do it, but this is the way we do it, and this is why we do it this way. Okay, so we do, condition, behavior, and measurement. And behavior doesn't mean maladaptive behavior, that's not what I'm talking about. So this is what we want the child to do. Okay? Condition is setting. If I spell anything, I misspell anything, I apologize. Environment, supports, okay? And then measurement is just measurement. You know, how accuracy over how many times a day, you know, over how many weeks, that kind of thing, okay? So we might write something like this. Given modeling and verbal prompts, and I'm not going to add it, but I mean you could write given modeling and verbal prompts in a small group setting, but we're all small groups here, okay? Johnny will initiate social interaction 4 out of 5 times per day. That's supposed to go up here, sorry. 4 to 5 times per day for 10 consecutive days. Okay? So you have the supports, you have, so this could be prompting levels here too. Okay? So you have the condition here, you have the behavior that you want the child to engage in, and then you have the measurement. Okay? What you will see on a lot of your IEPs, and we actually don't write them like this, you'll see 4 out of 5 trials, you'll see 80% accuracy, and the thing is with 80% accuracy, and you know, I could have a lot of people arguing with me, but I stand pretty strong where this is concerned. If you can't measure it in percentages, you shouldn't be writing it in percentages. So I'm not going to let one of my staff write, will initiate social interaction 4 out of 5 times per day with 80% accuracy. Because no one is going to measure that, right? And how are they going to measure if it's 80% accurate? Unless they do a task analysis, they have sequence cards, and then they're looking at, okay, did this child do every single step on this sequence? You know, and we have goals like that. Those are task analysis goals. But we're very careful about only using percentage when you really can measure using percentage. The other thing that we really try hard not to do is we really try hard not to have 50% accuracy, 60% accuracy, 70, 50% is failing, right? We don't want, you know, I mean, I once read a goal, honestly, I kid you not. So-and-so will stop at the stoplight and walk when it turns green 50% of the time, and I'm thinking, what is he doing the other 50% of the time? You know? And so it doesn't make any sense. The other thing is that the goals, if the measurement is so difficult, like when I read something, if I have to try to sit there and think about how to measure it, it's already too complicated for me. I don't want to bother, right? The other thing we do a lot of, instead of changing the measurement, so for example, 4 to 5 times per day for 10 consecutive days. We do the 10 consecutive days because this child does it one day, has a meltdown for the rest of the school year, he's met the goal. You want to show mastery or headed towards that. You know, you want to show kind of a habit forming. You don't want it just to be one day and then, oh, they did it on a Wednesday, so I'm going to check that off. You know? So you have to be careful with the way the goal is written. The other thing that we really try to do is we really only try to change one variable at a time. So I try to catch this on my staff's IEP. And they do write really good IEPs, I have to say, but they do this as well. So a lot of times what you'll see is, given modeling, so the next objective will be, given modeling, Johnny will initiate social interaction 2 out of 5 times per day for 10 consecutive days. So you're changing 2 variables. You're changing the condition, you're changing the measurement. Already that gets really confusing. So we try not to do that. My school of thought is this. I would rather change the supports than change the percentage. I would rather have Johnny will get 80, will complete, you know, I don't know, 10 math problems with 80% accuracy out of 10 opportunities. I would rather keep that 80% and then change the supports, given modeling and graphic organizers, given modeling and role playing, given modeling and, you know, or given verbal prompts, you know. So you're changing the supports. You can go from least to most, you can go from most to least. I would rather give more supports, have the child be successful, and then fade out the supports. Rather than having the child get, say, oh, okay, the child meets this objective, he gets 60%. That means 40% of the time he got him incorrect. I don't want that. Now, there you have to be careful because you don't want your kids to become prompt dependent either. And you want to make sure that you keep probing, that's an ABA word, but you keep probing, you keep kind of testing, you know, are they able to do it on their own? Are they, you know, so that you're not constantly stepping in because you assume they can't. We want to make sure that we give them plenty of opportunities to show us that they can, but it's a fine line between that and then increasing frustration, okay? So really, I'm very much for this kind of goal rather than, I mean, you think about it, so-and-so will complete or do this 2 out of 3 times with 50% accuracy. What is that? I mean, really, what kind of mastery is that? I mean, I would, you know, I would rather do hand over hand and have the child be really successful and then back off from that. So that's the way we write goals here. I mean, I can only speak for us, but this is the way we do it. Okay, so we talked about, let me just talk to you also about trials and opportunities. You'll see goals written 3 out of 4 trials, okay? A trial is this. A trial is, it comes from discrete trials. Okay, so a trial is, I'm sitting with a student and I say, and I show him a fork and a spoon and I say, which one's the fork? He hands me the fork and I say, great job. That step of 3 is a trial. When you do 10 trials, you're doing that 10 times, okay? We have our initiation goal right here. We're not going to do this in a trial. We're not going to have Johnny initiate social interaction 10 times in a row. We're never going to teach it that way. It's not appropriate. You know, and so it's always going to be out of opportunities. So, you know, my staff, they know the difference. They know the difference between opportunities and trials. If it's truly a trial, then it should be written as trial. But if it's not, if it's truly an opportunity, then it should be an opportunity. You don't want to write 10 opportunities per day when you know, student will initiate and use their PECs to indicate that they need to go to the bathroom 10 times per day. Well, no kid's going to go to the bathroom 10 times per day. Right? 10 times per week, maybe. So you also have to watch for that and making sure that the measurements are realistic and the opportunities are given. Another big thing is, you don't want to sit in IEPs and have someone say, oh, well, he didn't meet that goal because we didn't get to it, or there weren't enough opportunities provided. No, you can't, that's not okay. Okay, so here we go, accommodations and modifications. Are they the same? No, they are not. Okay? So, you're going to take notes on this, because my staff has been really well trained in this as well. Accommodations are any supports you give to the child that helps them access content level, grade level material. Okay? So an accommodation is extended time, small groups, large print, preferential seating, quiet place to work. Anything where you're not changing the content, that is an accommodation. So for our kids who are working at grade level, they get accommodations. They want to sit in the beanbag chair to do the writing, fine, sit in the beanbag chair. You want to dictate, you want to have somebody dictate for you, fine. You want to use talk to text, you want to have somebody write your answers down, you want to give an oral report. None of the content is changing. Those are all accommodations. Okay? Once you change the content, it is now a modification. So for example, we have kids in our diploma track classes who may be doing fine in world history and algebra, but they're really struggling with reading, and they're reading at a 3rd grade level. So we give them text that's in a 3rd grade level. That's really hard, okay? There are 2 ways we can go about it. Either that child is just not reading at grade level or way below grade level, then we're modifying the reading for them. okay? One of the ways we get around it with that group of kids is there are curricula out there that actually has, kind of waters down the reading, but it's called an AGS, we use AGS, where it waters down the reading, but the content is still world history. But the reading is much simpler, the print is bigger, it actually already accommodates, okay? For a child who is in a functional skills program, their whole program is modified. They still get accommodations on their modified curriculum, they still get extended time and they get all of that, but the whole program is modified, okay? Now one thing that we don't do, and some of the districts have asked us actually not to do it, is that we can't, for kids at our grade level, we can't say, okay, world history, I can't think of biology, algebra 1 are all, they're getting B's and C's, let's say they're passing their classes at grade level, but science and biology, what have I said? Writing, okay, so let's say writing is nowhere near as grade level. Let's say the writing, and let's say the child can't use, like, even when they use additional or alternative sources, they just can't do it. They're not at grade level for writing. What we're not allowed to do is put a report card where we have grade level grades, and then we say reading, and then we put a B because he's on a modified reading program. You cannot mix and match like that. Which is, it's hard because as a parent, you're getting this report card, your kid is working really hard, is doing really well, but they're 5 years below grade level, and we have to put an F. But here's the thing, you don't want it any other way, really. You don't want to get a report card that shows A's and B's and some C's, and they're in a diploma track class, and then you come to find that the child's been in a modified program the whole time because the child's not at grade level, and you're looking at this report card going, they just got an A, they just got a B. You do not want that, because that's a huge surprise to have A's and B's all along, and then all of a sudden have someone come along and say, yeah, they're A's and B's, but they're working on triple digit, addition. They're not in algebra. So as hard as that is to get a report card like that, you want it to be accurate, so you know exactly where your child is. So we've had a couple like that, and it's been hard for the families, it's been hard for them to realize kind of where their child is sitting at. But I keep just explaining, you want an accurate description. Now, that doesn't mean that that child isn't perfectly capable, but behaviors are getting in the way, or communication's getting in the way. It doesn't mean that, but you also don't want to be misled.